So thank you, Ted, for joining us today. And for our viewers who are tuning in or watching this video online, I really want to express our gratitude for you sharing your patient experience and story. It's really motivation for me to do whatever I can do, hearing all the stories that I hear from my patients, because you guys suffer through this disease, and a lot of people just don't understand how it impacts every aspect of your daily lives and how it can really, kind of transform things, not just in a cosmetic way, but in a functional way. And so thank you, and I'd love to hear and a little bit about your story, Ted, and express to people, what you went through. And maybe we could start by just saying how you were diagnosed, because so many people have a hard time with this in the very beginning.
Right. Well, thank you for having me. All your videos have been very informative, and I've probably learned more from that than anything. So thank you for having me. I was originally diagnosed in the year 2000 with Graves' disease. I was being very stubborn. I didn't go to the doctor or anything, and I noticed I was having problems sleeping. I was having problems. I lost a ton of weight. I probably lost about 60 pounds. And I'm not a real small guy, so when I lost that weight, it was pretty alarming. So then finally, just my wife looked at me and she goes, "I think you need to go to the doctor. Something's not right."
Yeah.
And like
the weight loss is pretty incredible.
it was something else. My body was definitely not liking that. The sleep was terrible. I couldn't sleep at night. I was exhausted in the daytime. I was drinking sodas like they were going to be discontinued because I just couldn't get enough of them with the caffeine. And I wasn't a big soda drinker before, so it was really a strange habit for me to develop. So finally, I went to my just general physician, and he looked at me. He was just this old-time doctor. He looked at me and he goes, "I think you have Graves' disease." And so that was pretty interesting. I had no clue what that was. So that's when I went to the local specialist here, the endocrinologist, and she said, "Yeah, sure enough." They did some blood work and everything, and they diagnosed me with Graves at that time.
Yeah, and how did you get your how was your thyroid treated?
They did the radiation, the pill. I guess it's a radiation, the large pill. That was kind of fun to swallow there, just due to the growth of the thyroid. So yes, it was radiated at that point. So that was in the early 2001 when I had that taken care of.
And did you just require one treatment, and then your thyroid was pretty good after that, pretty well normalized?
Yes, just one treatment, and then shortly after that, within about a month, they had me like on Synthroid, the supplement there, and I've been taking Synthroid ever since.
Okay, great. And when did you start noticing your eye changes?
The eye changes, it was around the year 2008, so it was about 7 or 8 years after.
Yeah.
Which
what was very unusual, by the way. Often it occurs within 18 months, but yours was very unusual.
Yeah, well, and I'm assuming they were probably changing through that time frame, but I started to notice I'd wake up in the morning with a lot of irritation on either eye. It would kind of fluctuate between them, and I just thought it was maybe the way I was sleeping at night. That I just didn't really know what it was, and it was about another 3 years until I found out what it was. So about 2011, I went to a new eye doctor, and he goes, "Well, Ted, your eye's not closing all the way when you sleep. So that's why they're irritated." So it was amazing how it took so long to figure that one out there.
Yeah. And I think when we met, you were having lots of problems with your vision. And certainly your eyes were very bulgy at that time.
Yes.
Too. And tell me a little bit about, the experience, of thinking about undergoing decompression surgery and everything. I mean, it's a really scary thing. And I don't, even profess to know what it's like from the patient point of view, but I think it would really help for patients to understand that there may be a light at the end of the tunnel if they want, but they don't necessarily have to always do it. And it's just education of knowing, what you were thinking at the time.
I had went to actually another eye doctor after that, and he had asked me, he goes, what kind of follow-up are you doing on your graves? And I was kind of mystified by the question. It's like, I didn't know I had to do follow-up besides the normal blood work every year just to make sure that the Thyroid was the proper dosage and everything. I didn't realize I needed to do anything. So he started to notice a change in my eyes even beyond, and he wanted to do an MRI. So about 3 years ago, we did an MRI, and he explained to me he wanted to make sure that the optic nerve wasn't being compressed, because that could lead to some major vision problems, if not vision loss. So it was just, once again, I learned even more there. And at that time, about 3 years ago, I probably looked at a couple videos online. Unfortunately, it wasn't you at the time, but I had watched some videos online about what the process was. And from what I recall, it used to be a lot more of an intrusive type surgery. And at that point, yes, there was some fear. And I said, I'm not doing that. I can live with this.
Yeah.
So it was okay at the time. But then finally, this last year, he wanted to do another MRI. In fact, January of this year, he wanted to do an MRI again. And we checked it again. And at that point, I started doing some research. And then that's where I found you. And I started watching the videos on YouTube, all your Thyroid Thursday and everything. And it was just it was so much more to me that reassured me that this could be something that I do. Yeah. So that's why I explored it and reached out to you guys at that time.
Yeah, no, and it was our pleasure. Tell me, what was, what was the experience of having a decompression like? I mean, no one, I think, can, be put into your shoes in doing it. And I know that there's always questions of, do you take the eye out and do you do this and that, and we do very small incisions, but tell me a little bit, walk me through your experience from your side. I know my side very well, but tell me about what it's like to be on the other side.
Well, even just starting with the consultation with you, I had seen a local doctor here in my town, and I told him that I was having a lot of pressure on the back of my eye, a lot of eye pain, and it felt like one of those like behind the eye headaches, and it was every day, all the time. And I told him that, and he said, no, that's not what's happening. And so that was kind of discouraging to me, because then I thought, well, geez, have I lost my mind a little bit? But then when
typical. That type of pain is so typical. But go ahead. I'm sorry.
No, exactly. Well, and that's what you told me. So when I came to the consultation, it was just such a refreshing message from you about, hey, no, that's exactly what you're feeling. That's what's happening. And so just the consultation right there, it really put my mind at ease. I was ready to commit to the surgery like right away. It's like, I feel good with Dr. Douglas. Everybody that I dealt with at your office was wonderful. And I thought, let's do this. And you told me you don't have to make any decisions today. And it was very comforting at that time. And we walked away from the appointment that day, my wife and I, and my wife's in the medical field. And she told me she felt really good about being around you guys at your office. And she was very comfortable with you. So if she was, I definitely was. It was definitely good to feel. Yeah. So every step after that was just incredible. It was just top notch. Coming back down, scheduling the surgeries, because I was from out of the area, so I had to fly into town. You guys made it really easy. You gave me options on where to stay. You allowed me to fly home between the surgeries, which was good. But I know it's because I live pretty close. So
yeah. I know that you are exception. But you also had pretty big surgeries too on each side.
Well, yeah. I was definitely a little bit nervous on the first surgery, and it was my left eye was the first surgery, and I know that was definitely more extensive. And I know even my wife was a little bit nervous because it was from what I recall, I think it was about a 3-hour surgery. and there was a lot of work to do on that left side. So definitely when I came to, what was amazing is that night in the hotel, I didn't feel the eye pressure anymore. I had some discomfort, of course, because of the swelling and everything around there, but the eye pain on the backside was gone. So I was just amazed by that the first day.
Yeah, that's what a lot of people say, is that pain pressure that they've lived with for so long all of a sudden is just gone. And you get pain from the surgery. And we did a lot of surgery for you. I tried to do both sides at the same time, but yours was just too extensive. We had to, break them up, and we did a lot. And you did really well. Was the pain and the discomfort and the process kind of what you were expecting, post-operatively, or was it easier, harder than you were expecting?
It was probably, I would say, easier than what I was expecting. Although that, like I said, that left eye, definitely the more extensive surgery, there was a little more discomfort and swelling on that eye versus the right eye. And definitely, and even because I know with the surgery being longer, you guys had to intubate me, and I know I struggled a little bit with that. And so my throat was hurting a little bit, so that was kind of crummy. The second surgery, that was like a piece of cake. This is great. So really at the end of both of them, it wasn't that bad at all. It was much different than what I thought originally 3 years ago when I did a little bit of research. It was much different. So even after the second surgery, I stayed a day down in Southern California. I could have flown home that day because that's how good I felt that second day, for sure.
Yeah, even considering how extensive the left side was, you did really, really well. And how's your recovery been since? Are your eyes more comfortable now? Or I know that there's always some little asymmetries. We just did the one surgery on you, and there's always you can go on and on with this forever, but most of it is just by what the patient and what you feel comfortable with. So I was just kind of wondering how you've recovered and are feeling and resuming life, hopefully.
Yeah, definitely the eye pressure's gone, which is great. So I don't get the headaches like I was getting before. The recovery has been much, much easier than what I thought it was going to be. I still probably have a little bit of issues with my sleeping a little bit when it comes to I still have to I have to wear an eye mask at night to kind of help myself a little bit. But I've been playing with it, trying different things, trying some gels and things like that. But and that's just because the eyes, they just don't close properly. I think that the eyelids. But beyond that, I'm used to that. I've been wearing like an eye mask at night to help with my sleep for 10 plus years.
Yeah, and there's always tweaks we can do to the eyelids now that we've gotten the eye back. But it really depends on just how that fits into your life.
Exactly, yeah. But when I look back at pictures, I do see a difference. And pretty much my wife, all my family, my friends, everybody's like, oh yeah, we can see the difference. And they see it. It's very big difference for sure.
Yeah, especially guys. We don't spend a lot of time in front of the mirror usually looking at that. It looks close enough. That's the one thing. And you were having some pretty severe problems with your vision and that pain, and so we went a long way. But we can always turn you into George Clooney before the motorcycle accident.
I don't think there's any surgery that'll do that.
Well, thank you so much, Ted, for spending the time and really volunteering to do this and kind of sharing your story. And is there anything else you'd like people to know, or just from from their own standpoint, whatever it is you felt that was most beneficial for you, or things or little tricks, anything that you'd like to share? Be happy to share them with anyone.
I don't have any of the makeup tricks that I saw the other day on Thyroid Thursday. I don't have that. But I can say that if you're having the issues that I was having with the eye pain, with the headaches, with the discomfort, this is worth it. I mean, this is totally worth it. It can change your life. I get a little bit choked up just thinking about it, because I thought I was pretty much stuck where I was at. And then you have really changed my quality of life, and I appreciate it. Every person that we dealt with, from your office to the surgery center,
oh, thank you.
Incredible people. You have an incredible staff and super professional, and I couldn't ask for anything more. And I just thank you guys so much.
Thank you. That's the highest compliment, and thank you. And I owe everything to them also. Well, again, thank you so much for joining us, Ted. So much.
Thank you. I appreciate it, Dr. Douglas. Thank you so much, and for educating all of us. I mean, without you, I wouldn't know probably 90% of the stuff I know now.
Well, hopefully that's a good thing. But
it is. It is. Thank you.
Well, have a great day.
You too. Thank you, guys. Appreciate it.